I was in the I was in the office the other day, and because they really have old carpet and old flooring, and I said, okay, so let me tell you about marmoleum and eco flooring and how we really ought to be moving towards that. That's one project that I'm in the midst of down there, and my husband has helped with Friendship House is working on shelter work, and they're renovating at St. Steve's. I don't know, St. Stephen's somewhere, but he's kind of working on that project as well. So
Somebody
it's
was telling
something
me they're working on doing some kind of a building at Sam.
that uh, I can't tell.
He's in that lot that's next. I guess it's on Shipley Street.
This is a renovation of a church basement that provides a warming shelter or a night shelter for people.
Yeah.
And a friend of my husband's has been volunteering there since he's retired, and he kind of took charge of working on the renovations. So Charlie got involved with that from
Yeah.
from there.
And that's it. Would you just say St. Stephen's?
I can't, it's not, I don't think I think it's Matt. I don't know. There's like five different churches, and I don't know all the details of it that provide these places for people to stay.
Yeah.
And, so this is one of those places, and the bathrooms needed renovation, and the heating system needed renovation. So they're working on that. But all of it's pretty, it's really what I need to be doing in the era that we're in, right? Because otherwise you're just depressed.
So we are a nonprofit educational organization, and we invite everybody wishing to explore and share and discuss. We have partners who are the Sierra Club, Citizens Climate Lobby, Plastic-Free Delaware, uh, Delaware Nature Society, DEVA, which is the Delaware Electric Vehicle Association, and Power People for Offshore Wind. Um, so that is that. Do you want to say a little bit about yourself, please?
Thanks, Jill. No, I'm in this case wearing the technical assistance hat for Jill. We're partners in getting green drinks out
Crime.
as she described. Partners in crime, yep. So appreciate everyone's participation every month. It's great, and happy to have Sarah and Amy here tonight. So anyway, I think enough said. I might put some links in the chat of events we have coming up at Plastic Free Delaware and elsewhere. So thanks, everybody.
And Gail, I was going to respond to you that we are recording this, correct? So you can catch up on it later. So I just Amy and Sarah, you guys are wonderful. Let me have you introduce yourselves as you do your presentation. Would be just wonderful. So, and shall we hold questions till the end? Is that the better thing to do?
I think that works well, or yeah, just put them in the chat. But yeah, we'll definitely leave plenty of time for questions and answers because we'd love this to be interactive.
Okay, fabulous. All right. We're excited to have you. Kick it off.
Thanks so much. As Jill and Dee said, I'm Sarah Bucic. I am co-chair of Lead-Free Delaware. I'm here with Dr. Amy Rowe. Amy, did you want to introduce yourself?
Hello, keep going.
Okay. Amy Rowe and I have been working on lead poisoning prevention in Delaware for nearly 10 years now, and we are volunteer advocates. We have certainly been involved in a lot of environmental things over the years, but this really caught our attention. Can everyone see my screen okay? That's good. Okay.
Yes.
So just to give you a brief background of how we got started, as I said, Amy and I have been working on a lot of environmental things over the years as citizen advocates, and I live next to this huge water tower that started flaking. Well, they were redoing it, and paint chips started falling in my yard. So I started calling DNREC and Delaware Division of Public Health, and we started getting pinged back and forth. And at the end of the day, we realized that there was no permits required for outdoor lead paint removal, and we went and started making sure that there was a process so that, when lead paint was being removed outside, that there were still regulations in place. I'm next to a school. At the time, I had a 7-year-old. There are, a lot of lead is not good no matter where it is, whether it's inside the home or outside the home or in soil. We'll get into all the different sources of it. But long story short, Dr. Rowe and I started looking into the lead situation in Delaware, and there were a lot of, we were very, very behind the states around us. We ended up working on banning outdoor lead paint in Delaware. We're still the only state to have done that, the outdoor application of lead paint on, structures. And we passed a number of bills, but there is still so much work to be done. A lot of states around us have been doing things certainly since the 90s. And so we have a lot of work to do, which we'll talk about tonight. Tonight, I'm really going to focus on some of our stuff with schools, just because that's a place where we require children to be. And, we do have a lot of old schools in Delaware. So basically, like I said, we were just established in 2016. We are all volunteer organization. So in my other life, other hats I wear, I'm a registered nurse. As I said, I'm a parent. Dr. Rowe is certainly involved in a lot of other community activities. But for lead, we really interact with a lot of other groups. And we just have one goal: to prevent childhood lead poisoning in our state. And we are committed to eliminating lead wherever it is. So a lot of times groups that work on lead, and this is just how it is. You work on lead in paint or lead in water, and we work on all of it because we just don't want children to be exposed. We don't want anyone to be exposed. So some of the things that we've ended up working on are around government transparency. We'll get into a little bit about some of the things that happened. For example, I'm sure some of you heard about when there was lead in school water. When we really were advocating for really, robust transparency. People should know what their water is where their kids go to school. We also have been working on universal screening. When we first started advocating for lead poisoning prevention, less than half the kids in our state were getting the testing that was required. Now we have advocated to have another test. Children are tested 12 and 24 months in Delaware for lead poisoning, for exposure to lead. But at the time, people just weren't getting the tests. And there's a variety of reasons. There's a lot of barriers, but we work on those too. We work on schools. We work on getting the lead out of rental housing. We work on water. Also, there's all kinds of outdoor hazards. There's industrial sources. We know if you are involved in firearms, if you go to a shooting range, there's so many sources of lead that it's really it's in our environment. And that's one of the reasons we really advocate for testing children. It's not ideal. We shouldn't be testing children for things that are in their environment. But because lead is so ubiquitous, it's really the best way, because people, if you ask them, they don't always know all of the exposure sources, myself included. And we also advocate for improved services, which I'll touch a little bit on. So here's the big thing with lead. It's not something that's going to jump out at you necessarily. There are cases where lead goes really high and it's a little more like, you might find the source, it's very obvious. But it's something that often it gets, it presents with a lot of other things. And we know that children, your birth to 5, your brain that's like a huge part of your brain development. So, any exposure for children, there's no safe level of lead. One of the things that's over recent years there's been a lot of research in is how these much lower levels really affect children's education and school performance, their math scores, their reading scores, things that, we used to, back in the 70s when there was an initial ban on residential lead paint, we were seeing much higher amounts of lead in children. But we know even as it's coming, the national average is coming down, it's still impacting children's development and their brains, and their ability to reach their full potential is really still being affected. It does affect IQ scores. It affects behavior. One of the recommendations out of the research is that we should, anytime there's a behavioral issue, a child should really have a lead test just to rule that out, so that people are treating the right thing. Lead can actually be an intergenerational issue. Lead is actually stored when it goes in the body. It gets stored in fatty tissues, and it goes into your bone. It mimics calcium. So when that person grows up, if that person decides to have a baby, the lead can actually come out of their bones and go into their fetus. So we have this intergenerational thing that can happen as well with lead. And then there's definitely a lot of research coming out now about the cardiac effects of lead. Traditionally, we've thought about children, which is incredibly important, but we are now seeing a huge body of research talking about how it's linked to cardiovascular disease, kidney, all kinds of issues, things that throughout the lifespan, it is not something that is ever a good exposure. There's no purpose for lead, so there's no safe level. And that's lead is one of the most researched environmental toxins of all time. And so there's no debating it. The debate comes to how we address it. And unfortunately, with lead, the people that get impacted the most are Black and Brown communities. They are communities without resources to remediate their homes. They're communities who are in rental housing. In Delaware, we just passed a bill for the first time this year that will start requiring rental housing, looking at rental housing to have lead safe, a lead safe assessment. So, we're a little bit behind here, but, lead is huge. So we don't have any ability to not act. And so basically the bottom line is we can't rely on signs and symptoms. Lead will not present as something completely obvious. So that's why the lead test is so critically important. As I mentioned, the housing issue is a huge issue in Delaware. We are an old state. We have a lot of housing that's pre-1978. 87% of kids in Delaware who live in housing built before 79 were poisoned by the lead paint and dust in their homes. And then the kids who live in rental housing, 77% of them who were lead poisoned who lived in those older homes were in rental housing. So, we have this huge issue in Delaware. We have a lot of old housing. And, people often think when Amy and I first started, we spoke to legislators who really were like, oh, we thought this was solved. The problem with the 1978 cutoff is that's when it became illegal to apply it indoors, in homes. But the amount of lead paint that's still out there is tremendous. And it's not just children. As we said, it's throughout the lifespan, but kids who are, in foster care, kids who spend time at different homes throughout the week, children who have different issues. Some children eat non-food substances. They're at high risk. We know that kids who live near, for example, if any of you remember the St. George's Bridge issue that happened back in 2000, Amy and I were remembering this years ago, where they had to test all the children in the whole town because they sandblasted the St. George's Bridge and there was huge pieces of lead falling into the river and it, rained down on the town below. So, there's still paint on bridges. Children who are from other countries, there's different types of foods and pottery and all kinds of things that put people at risk for lead exposure. As I said, during pregnancy and breastfeeding. And then there's a number of occupations that we had a battery factory here in Delaware, and folks who work around those kind of things are very familiar with the dangers of lead exposure. So there's a lot of different exposure sources that are really just hard to know, all the places you can be exposed. So lead paint and dust in the home is the leading cause of childhood lead poisoning. As you probably, if some of you you're all Delawareans pretty much for the most part, or close by, we had an issue with lead in our school drinking water. So it was legal to use lead solder up through 1986. You probably have heard that under the Biden administration, there was money put forth to redo all the lead pipes in the country. And as of right now, that's still moving forward. It hasn't, been rolled back yet, which is great. But there's a lot of concerns because just knowing where all the lead pipes are, replacing them has to be done safely. We have to make sure that, when you're cutting those lines and replacing them, the solder, that we're not disrupting, lead and making it, air, into the water supply. There's all kinds of things, and I won't read this slide off, but as you can see, there are a number of sources, and it is really, in Delaware, we used to use a screening tool to ask parents of 24-month-olds, do you live in this zip code? And there was a huge number of zip codes in Delaware that were at risk, And, if you spent more than 5 days a week there, then you were at risk. I mean, there's so many sources of lead. If you all recall, just a year ago, there was lead in applesauce, the little pouches that you give to toddlers. So there are just so many sources. It's really hard to know, which is why we rely so much on the blood lead test. It does not take a lot of lead to cause lead poisoning or any kind of, elevated lead level. It is an incredibly small amount. So that's just something I always remind people. A lot of our laws that we have for lead poisoning are not necessarily health-based. So for example, a lot of our EPA rules around lead, are for children 6 and under. That's not because at age 6.5, you magically aren't affected by lead. It's really not good at any age. We don't want teenagers exposed to lead. We don't want adults exposed to lead. So that's like a cutoff that's made by the EPA. That doesn't mean it's healthy at age 7. In addition, in our water supply, there are legally, enforceable levels. Those are not health-based standards either. There is no safe level of lead exposure. So that's just something I repeat a lot because there's a lot of limits out there for the law, and those are not health standards. The only health standard is 0 or in drinking water, or up to 1 part per billion in drinking water. So it's very low, if not 0. So some of the stuff that we've been working on, Dr. Rowe and I, is really working around schools. We work on a lot of different stuff, but with the EPA grant that happened during COVID, all of our schools were tested. All of the school water was tested. It turned into a big debacle, for lack of a better word. It was on the cover of the news journal many times. Our water was never tested in Delaware until we had that EPA grant, at all of the different drinking sources. So this is something, it's an ongoing issue. We work to eliminate lead paint, dust, and soil hazards. As I said, we have old schools. We have a lot of schools that were next to highways where we had leaded gasoline going down, I-95, all of that soil, all of that is still there. If it wasn't remediated, it's all still there. And we're also really advocating all the time for funding. When Dr. Rowe and I first started, Delaware was the only state that on the East Coast, the only state on the East Coast, except for West Virginia, that did not fund its own lead program. We relied on a very small number of grants 10 years ago. We are happy to say that there is more money being put into lead poisoning, but it's still not nearly enough. And it's not nearly commensurate with the states around us who understand that this investment in lead is, a huge investment for the future. This is connected to the school to prison pipeline. It's connected to our reading scores, our education scores, our need for, special education services. All of these things are affected by lead. It is literally one of the places you could put your dollars today and see a benefit in the future. So we're always advocating for funding. So this was what I was referring to about the lead in school water. Dr. Rowe and I were really surprised because we knew that the state had received this grant from the EPA and they started doing testing during COVID. There wasn't a lot of explanation given. Test kits were sent to schools and custodians, weren't given the proper information about how to do these tests. And how we ended up finding out about a lot of this was we were at a lead meeting and one of the schools had their water completely shut off. And the families weren't told, and the staff wasn't told, and there was really no information going home to communities, which is really not part of what the EPA requires as part of these grants. The EPA requires constant communication, a good information flowing between the community, the school, the water testing. So this hit the news journal, and it really got us looking at what we should be doing in Delaware. As I said, the American Academy of Pediatrics says water shouldn't be over 1 part per billion in schools. So after we advocated for a lot of different things, Delaware did commit to a filter first program, funding contingent. So basically what that meant is they initially allocated $3.8 million to retesting all the schools. And from that, there is still $700,000 that they haven't spent. They did put 954 filters on drinking water taps. So, that is great. There's still a lot more that needs to be done. filter first strategies, like they use that in Michigan, which basically means every single water source that a child drinks from should have a lead safe filter, a special ANSI filter on it that is changed frequently and tested and, is used on any drinking water source. So is the school water safe? It appears to be safer, but we still don't have a drinking water standard in Delaware. So right now, when this whole thing first blew up back in 2022, Delaware was using this 15 parts per billion legally enforceable level inappropriately. They were using that as a health-based standard. And we ended up contacting the EPA, and the EPA ended up telling Delaware, you have to use a lower level. So we're using 7.5, which is still not safe. So we really need to get the water levels in school down to 1 or less. So that's critical. So that's something we're advocating for. As I was saying, a lot of these legally enforceable standards, as anything in the environment, there's these standards and, they're not always health-based. So this 15 parts per billion on the right side of your screen, that's not health-based. That's just something that they use to kind of tell if the corrosion control, if you all remember Flint, Michigan, if they can tell if the corrosion control is working or not. It's really not meant to be used as, a point of, health. You can see the World Health Organization says we should be using, much less than that at 10. The new lead and copper rule also says 10. Delaware is using 7.5, pair the instructions from the EPA. There is a law that passed in Delaware in 2022 that now, requires schools to be using down to 5 parts per billion. For example, people often think that bottled water doesn't have lead in it, but bottled water can have up to 5 parts per billion. That's the standard for bottled water. And as you can see on the right-hand side of the screen, the actual health-based standard is 1 or less. So that's what we are really advocating for in Delaware. Our children are required to be in school, so we should have clean drinking water and clean buildings, and children shouldn't be getting sick by going to school. This is just some information about the water testing that occurred. They retested 6,592 taps, finding 802 of them that were problematic in 139 schools. So the thing about lead poisoning is in situations like this, it literally affected all of, it got a lot of traction because anyone who sends their kid to a school, this is an issue. This is something, that everyone can tap into. We should have clean drinking water. So you can see here that, there were a number of elevated results. As I said, there were a number of filters put on, but we actually don't know how many still actually remain that need to have filters put on them. And as you can see here on the bottom, the highest level, this was the school that turned their water off. It was 5,400 parts per billion. Remember, the safe level is 1 or less. And we had a school in Delaware with 5,400. And this is not just an issue for the children. If you think about teachers or pregnant people working in a school, anyone working in a school should not be exposed to something like that. That's just so dangerous. So this bill that was passed in 2022 that looks at the standards of good repair for schools, it required school districts to assess buildings for hazardous materials. The school safety assessment tool should address lead hazards in school buildings and have public input. Now, the initial bill didn't have lead in it, but they assured Dr. Rowe and I that it would address lead. We are participants in the ongoing meetings. That's something that's kind of to be determined, but there are assessments that the schools are supposed to be having, for soil, for water, and to look at the lead hazards in the school buildings. We really want the lead safe schools to be codified in Delaware law. We want filters on every tap. We want a health-based drinking water standard. We want lead-safe certified contractors. One of the things that's really disturbing in our schools is that we don't require lead-safe contractors, which, that's just unbelievable. I had a kid that was going to an elementary school and they moved some of the kindergartners to another school. And then I realized that was because those kids were under 6. So, that doesn't mean that the people doing it weren't doing it safely, but I don't know. Delaware didn't require them to be, lead safe certified. So that's a huge concern. Anyone who's doing construction or remediation, abatement of any sort in Delaware schools should be lead safe certified. We need these lead hazard inspections in all schools. We need soil, dust, and paint standards, staff training, mandatory reporting, and as I said, adequate funding. We're really looking at the Department of Education to promulgate regulations so that there can be public input. Historically, we've had a tremendous amount of support for this, and we think that will continue. We just need to always keep momentum on. As you know, there's a lot of competing interests right now. There's a lot of issues with what the budget's going to look like this year, but this continues to need to be a priority. This is just something that happened in Milwaukee. This was their situation with lead paint hazards in schools, where they actually closed their schools. Now, one of the things that Dr. Rowe and I were talking about just before this call was they were testing the children in schools. And one of the things that was really frustrating in our situation in Delaware is by not telling people and not recommending testing, we don't really know what the exposures were. Delaware kind of stopped short of that, recommending that just, talk to your provider. But really, there are places in the country where they've been able to pinpoint, and do the testing. And as I said, that testing is the best way to see exposure. And so, Milwaukee's kind of a really amazing and dramatic and sad case study of how, these old schools, really need to be addressed in a very safe manner and what can happen when they're not. So as I was saying earlier, the lead levels at lower and lower levels, it's great that our average levels are coming down, but we are still seeing huge effects. Even under 3 micrograms per deciliter, we're seeing decreased end of grade test scores. As you can just see on this slide, poor performance on tests, all of these things are directly related to education. And we have found that educators are a really huge part of support for this because they are seeing the outcomes of this. One of the great things about determining if a child has been lead exposed is once you determine that they have, you can do a home lead risk assessment. You can determine where the lead is, and if you can reduce the amount of time that they're exposed, that's incredibly helpful. And once you know they're exposed, there are things that you can do. There are certain foods you can eat. There are certain things that you can, reduce the absorption. And the best thing is that if you're birth to 3, you are eligible for, early intervention, things like Head Start. In Delaware, Dr. Rowe and I worked so that anybody who tests over 5 parts per billion is automatically eligible for early intervention in Delaware. So this is really something that can help children. So, even though lead poisoning is not reversible, you can really minimize the impact by finding out early that there's exposure, figuring out where the exposure is, and then really, getting the child involved in, things that stimulate their brain and early childhood education. So, sorry. I think I might have gone past a certain slide here. So one of the things with this whole, this slide talks about end of grade test scores. I am also on the board of the Delaware PTA, and we just had our annual convention last week, and we had Cindy Martin, who is the new Secretary of Education. And she was talking a lot about the importance of literacy and the importance of reading. And so we have an action item for folks here tonight. If you feel so moved and you want to take action, we're asking you to reach out to her and to include lead safe schools in the fiscal year 2027 budget. So there's also a meeting on Thursday where you can make this request. You can also submit public comment, written public comment, or you can dial in and speak virtually. This is kind of something we're really asking folks to do. We were just part of a press conference last week that's focusing on lead and rental housing, but we really focus on the school stuff because schools are, we can get our hands around schools. We know where they all are and we know the outcomes. So this is something that really should be a priority for schools. So we are asking you to reach out if possible. And then you can also find us on social media and stay connected with us. We will not spam you. We will not share your address, but we do send out things every so often. Dr. Rowe also chairs the Childhood Lead Poisoning Prevention Advisory Committee. There's a lot of meetings for that. There's a lot of things that happen around childhood lead poisoning. And we do try to keep people updated on those things. So I will stop there. Amy, I don't see the video I was going to show. So let me just go back. Does anyone have any questions so far?
There's a couple of questions in the chat.
Okay.
The first question in the chat is there ongoing testing in schools or was it a once and done? And what other testing is being done on an ongoing basis? So it's not a one-time, once and done. We've been assured that the Department of Education is going to do a resampling starting in June, and that they're going to continue to resample on I think it's a 3-year basis moving forward. So that is their commitment, and they have a plan in place to accomplish that. So that's the situation with water. There is no commitment yet to do any sampling of lead paint hazards, lead dust hazards in school buildings, or lead soil hazards on school grounds or on playgrounds. So those would be very, very important if we want to make sure that the schools are not contributing to lead poisoning. And then another question in the chat is there any tracing being done on the sources of lead in the tested samples? So yes, and how that's done is with time. So there's like an initial test, and then they let the water run for 30 seconds, and then they take another test, and then they use that to figure out how far back in the line the lead contamination is. Is it in the fixture? Is it in fittings below the fixture? Is it in the pipe in the building? Or is it in the service line? And in that case of the 5,400 ppb at the Wallace Wallen School in Newcastle, they determined it was a trunk line that was feeding the entire school building. That was the problem there. So they had to do a lot of major digging and replacing of lead lines. I don't see any other questions in the chat, but we can certainly take them verbally too.
So when they school test, do they test the sites where the filters are?
Yes.
After the filter. And what does the kid testing kids look like? What do they have to do that? And does it involve permission from parents to have the test done, or is it something simpler than that?
So for the first part of the question, which is all of the testing is done at the tap. So if a filter is in the line, it's tested after the filter to see if the filter is functioning properly, and that's important. As far as testing kids in schools, this is something that we are trying to figure out how to do as a state. When the story blew up in the newspaper about the water in the schools, the state responded immediately and bought school nurses capillary finger stick machines.
Mm-hmm.
So that school nurses could test children, presumably, that were perhaps at risk for lead exposure, like using, for example, water from one of the taps that was high. But those didn't actually get used. And we've learned that just this past summer, some of those were still in the plastic wrap. They had never been opened. So figuring out how to either get those machines actually used in schools or to pull them out of schools and put them somewhere where they will be used is kind of an issue. Second thing is that the state Department of Public Health did a pilot project this year to try and sample school-age children for lead with a capillary finger stick in school. They did kindergartners. Everybody who was sampled was at the end of their kindergarten year. So they were 5 and 6 years old, so school age, and they found kids with lead poisoning. So this is just expected, but also alarming that we still have kids, even at that age, that have lead exposures and need to have their lead levels addressed. The state just issued a report on the outcomes of that pilot, and I'm going to drop that in the chat. I think I can do that. With all of the sort of obstacles they identified, there were a lot of obstacles that they identified on how to get this successfully running. And we are hoping that we can have funding to have that run again next school year so that the lessons learned can be acted on and we can actually have really robust school age lead testing for children in Delaware.
And in that case, you still wouldn't be able to identify what the source was for that particular child's lead poisoning,
Well, that
because it could have been
initiates
at home, it could have been, yeah, in
that
other places.
it initiates a process that the state already has in place. So
Okay.
if you have a blood lead level over 3.5 in the state of Delaware and you live in a house built before 1978, you get a professional lead assessment of your home. Everyone does. Under the age of 18, and you have a blood lead level over 3.5, which is the federal blood reference value, you get it. And then they decide where are the lead paint hazards in the home. If that doesn't bring the blood lead level down, the state has started now doing environmental assessments where they'll look at your spices, they'll look at your toys and things like that. And then, like in the case of Milwaukee, it's really amazing how Milwaukee does it. And I think that they serve as a really good model. They had one child that had an elevated blood lead level, like above the reference value, and it wasn't the home. It wasn't grandma's. So then they went to the school and found it was the school. And then they tested every kid in the school. And then they tested every other school. And they tested a lot of other kids in other schools. And they shut several schools down. And this year, 2020, this just happened. This is a 2025 story. In the New York Times kind of thing. Uh, the they're doing lead hazard assessments in every Milwaukee school, and they've got to develop a plan to address them. And they've relocated kids from high risk areas into low risk areas, either in school buildings or to other schools to try to resolve it. I mean, they're being truly responsible. And adding on to that, they've had like the lead poisoning prevention program at the federal level was shut down for months in the spring and then again with the government shutdown. So they're kind of doing it without a lot of federal support.
Imagine that. Oh no.
Yeah. Yeah. Imagine that.
Natalie,
Okay, so
I'm sorry. Go ahead, Renee.
what do you
I
think?
saw Natalie as her hand raised. So
Oh, sorry. I keep kind of, trying to go. Okay, so testing kids in school would give you a picture, a pretty broad picture of families with children and their housing. And it would be a good place to start, right? I mean, I think that's what you're saying. And since it affects younger, you wanting to know if it's affecting younger children because it's a larger effect, right? So that seems like a wise place to start, and then to backtrack to where they live and where the housing is.
The research also suggests that if you're exposed to lead at school age, you are more probable to end up in prison, more probable to have serious behavioral problems in school. And so there's a real, like, the focus of lead poisoning prevention in America since like the 1950s has been on the
Yeah,
youngest of kids because they're chewing on the windowsill.
yeah,
But these older kids are also impacted. And so it's just amazing that Milwaukee would look at school age kids. The school that was affected in the initial school number one, was grades 3 to 5. So those are not little tiny kids.
Yeah, I have a couple questions.
Uh-huh.
Um, I worked for public health a long time ago, back in the 80s. I worked for WIC, and there was a lead screening program through the state public health. Does that still exist? I mean, they had a lead nurse who tested kids, and then they had a guy, I think he was like an environmentalist, who went in and checked the homes and oversaw the remediation. So does the lead program of Delaware still exist as a program?
Yes, but I'd really like to know how long ago this was, because that
It was in
sounds
the 80s.
amazing. In the 80s. Okay.
Yeah, yeah, because
So
I was friends with the lead nurse.
the lead program in Delaware was established decades ago, and it functioned at varying capacities, but things
Mhm.
really started to fall apart in 2012. And
Oh,
we've done a lot of Freedom of Information Act requests, and we cannot figure out the why it
hmm.
started to fall apart in 2012. But things like the public accountability portion of childhood lead poisoning, which was the Childhood Lead Poisoning Prevention Advisory Committee, they were dissolved in
Oh,
2012
oh,
without any legislative action. So we were reading the code like good nerd advocates, right? We're just like, all right, let's learn the law. And we're like,
mhm.
where is this committee and when can I speak to them? Because they need to know these things. And they're like, oh, it doesn't exist anymore. So we had to get that restarted with legislation, which was in 2019. That's when that occurred. So they technically have case managers. The case managers are no longer nurses. They are now community health workers. They get very minimal training. They, we get, when you're involved like on the ground with lead poisoning, you get all of the real information from the public. Like Sarah and I are contacted on a routine basis by impacted families, and we get the story without it being the sanitized version that the government gives. And we just know that that's a dysfunctional process. The caseworkers don't call the family unless we remind, hey, you haven't had your caseworker call this family in, so many months. And so it's been, I think, a real struggle to get this back to the semblance of what you've described we used to have.
Wow.
But the childhood lead poisoning prevention program still exists. Its website looks like it's from 1980. I mean, it's not up to date at all
Well, I
with,
mean,
It's
do they
not
have
user
staff?
friendly. You won't be able to find like reports. I mean, it's not easy to navigate.
and it's full of broken links, right? Things that don't work anymore. The phone number for the lead poisoning prevention program sometimes works and sometimes doesn't. I just have it as a routine. I'm going to call it to just track how many times I can actually get through. So that's like rudimentary, difficult things. They do have these case managers. They don't have a medical license of any kind, like not a nursing license like they used to. There are the contract workers that the state now employs, like to do the lead risk assessments. That is something that we're really trying to push for funding for so that program can continue. And then they're doing with a new program established in 2023 through legislation SB 9, which was sponsored by Sarah McBride. There's a program where if you live in pre-1978 housing, you have a confirmed or venous blood lead level above 3.5. You get the lead risk assessment of your home, and it shows lead paint hazards in your home. The state will address those lead paint hazards and make it safe. So that program has been officially launched for not quite 2 years. It took a while to get it going. It hasn't done nearly enough homes. It hasn't figured out a lot of the, like when you do things without a lot of like direct oversight and management, things go sideways, and a lot of things have gone sideways with that program. And so they're learning everything on the learning curve, which is pretty steep. But, that does exist. We're trying to get those things ironed out, like through public pressure. It's only through public pressure that things will get ironed out. I mean, that's one of the things Sarah and I have learned over the years on this is that without public pressure, it's nothing will be even acknowledged as being a problem. I mean, the amount of effort it took to get a map by zip code of lead cases in this state was like astonishingly hard. So
Yeah. So you mentioned these case managers. Do they get like referrals from pediatricians, or like who's testing these young kids?
Every blood lead test, every capillary test, every venous test, the lab that performed the test, or if it's a capillary, it would be at the doctor's office, the nurse's office, the community center that has the machine, is required by law to submit those results to the state within 14 days.
Okay. And
then they get it and they put it into their database, and then it spits out caseworker lists, but it also spits out lists of eligibility for referrals to the Birth to Three program. So that got started. We realized, and I don't know if you know Dawn Alexander. She was a advocate with her union. Now she works for DOE. But she figured out, like an advocate, one of us figured out that the referrals were never being made from the lead program to the Birth to Three program for early intervention services. So because of public pressure, they started doing it, and it worked great for about a year. And then somehow it just kind of like slacked off. So we had to get an update from Birth to Three on their number of referrals, which we did. And they documented that like there was a substantial decline. So now they're reassessing their things, and hopefully it'll do it again. So the moral of that story is, even if you make progress, it's not going to last without consistent public pressure and eyes on the problem, which is, I think, kind of a burden for the public to have to continuously do, but that's where we are.
Yeah. Yeah. Because I remember my grandson.
You can get an assessment of your house, what that program is.
Natalie, did you want to finish your thought?
Amy, you had said the program somebody could get their house assessed.
Yeah, let's let Natalie finish her thought.
Oh, no, I was just going to make a comment that when my grandson was identified, and I guess they reported to the city of Philadelphia, he immediately received the what did you call it? Intervention, like the early intervention services and it was great. It was like for a year or so.
Yeah, Philadelphia seems like they have their thing together. They have it together with schools, for sure.
Well, they're getting there.
They have it together.
Now, this was, I guess, almost 8 years ago, because he's 8 years old now. The other thing I was going to ask is, my daughter at the time, she was contacted to testify before the city council because they were trying to pass a law that required landlords that required, if they're renting to a family, had to test their properties before they were allowed to rent them. Because at the time, and they were living in South Philly at the time, there was no law about that. No one knew. But I think since then they have passed that law. Do you know if there's anything like that in Delaware where landlords?
They did pass their law, and the fine is like $1,000 a day for non-compliance.
Oh, so wow.
Their law is pretty good, and I've met with their team, and they seem to know what they're doing. And Delaware right now has nothing except.
Oh, said there? You mean Philadelphia?
Philadelphia, yeah. Delaware passed a bill this year, HB 70, that will hopefully initiate something for the state, but there were a few provisions in that bill that were placed in there at like the bequest of landlords that will allow it opportunities to get clawed back. So that is a process that is hopefully going to get worked out, and the bill can stay intact, but between now and March, it's fairly uncertain what the future of that is going to be. but hopefully
Yeah,
it will be, because rental housing is the leading cause of childhood lead poisoning in this state. Yeah.
yeah, yeah.
Yeah.
Okay, thanks.
I'm
And just
sorry, Lori.
Well, I just wanted to, you said there was a program where they would come out and assess somebody's house if they got a certain result in Delaware.
Yes,
What was that program?
that's called the Delaware State Lead-Based Paint Program. It still does not have a website. The,
Delaware.
De the Delaware State Lead-Based Paint Program. It still does not have a website, but they get referrals directly from the Childhood Lead Poisoning Prevention Program for eligible children. You have to have a venous confirmed blood lead level at or above 3.5, and you have to live in housing that's built before 1978, and you get an inspection. And then they will fix it if they find lead hazards. And I will say we can all thank Matt Den at Action for Delaware's Children for having the vision on this, because he was really the leading effort on that.
I have a question. It's Letty. I lost my video.
Letty, I see your hand is up. How are you, sweetheart?
I'm fine. I wanted to find out a little bit. I'm not knowledgeable on remediation when it comes to paint and houses.
Okay.
Do they have to take the paint off, scrape it off, or do they paint over?
Well, this is a topic that we are currently in arguments about.
Mm-hmm.
The state law on this says that the Delaware State Lead-Based Paint Program has to abate or remediate the lead hazard.
Mm-hmm.
The Department of Health and Social Services, through regulations, has defined abatement. And that's a pretty strict standard. But remediate is still undefined.
Oh, okay.
And so that has opened up the door for weird things. Like, I'm aware of one house where they came into the home and they just painted over the door frames with lead block paint. There is this lead blocking paint, but it's not by label to be applied on door frames. That is an off-label use. It voids the warranty.
Oh, okay. Mm-hmm.
So we're learning from the real public kind of some of the loopholes that need to be closed. And we have demanded that that language be defined in the law so that everyone is on a common understanding.
Mm.
Yeah, but that's a tricky one, Letty, because
Well,
you could have a permanent solution or a temporary solution, right? And we have homes, and there is data collected on childhood lead poisoning cases in Delaware since 1994. That's when we started collecting the data. We have data on this, but it has never been analyzed about the same household repoisoning generation after generation of child. So you have, X address, like 1 Walnut Street or something. Has that house been responsible for numerous cases of childhood lead poisoning over the last 40 years? Because that is, really possible, or 30 years. That is really possible, but we haven't looked at it in that way. And I think that's a real detriment to how everything has been operating.
The Union Gardens housing in Wilmington, that goes back way back.
Yeah.
And I was wondering, one of my family members lives in one of those housing, and how the only way we would find out is scrape something and have it analyzed. And
yeah. Well, there are companies that will also do it.
And there, you don't have to scrape it. There are instruments like an XRF that when they do the lead housing assessments, it's basically like you just point it and it can tell what's underneath.
It's like a miniature portable spectroscopy machine.
Was, if you're buying a home in an older section, I mean, our house here north of Wilmington it was built in the early 60s, 1960s, but I'm thinking, the thought escaped me. When you're buying a home, especially in the older section, there's no way of really knowing unless you
Well,
do.
that's true. There's federal law for decades that requires an owner to disclose if they know of lead paint in the
Yeah,
house.
well,
But if they don't know, then there is no requirement. And I think that's the kind of thing that we have to start like closing these loopholes. Like
Yeah.
I would love to see as part of the whole property sale process, a lead inspection on some of these older homes so that, I mean, that just makes sense.
Yeah.
yeah,
Yeah, I know. And my daughter, they end up buying an older home in New Jersey, and of course, after their experience at Philadelphia, they made sure that they had the
Yeah.
home
Well, New Jersey's
tested.
had lead laws for housing, for rental housing since, for decades.
Oh, do
So
they?
like they have a pretty, yeah, they have a pretty good process there. Although their fines aren't as high as Philadelphia.
they're supposed to have replaced the piping in New Jersey in many areas. They're having a program that's going on.
Yes, they've replaced piping
Mhm.
proactively in a lot of municipalities.
Yeah.
They've been very aggressive about that. And they've been aggressive about going after federal grant dollars, which is something Delaware hasn't done. We haven't been aggressive about that. We had a program where HUD, the U.S. Department of Housing, and Urban Development, they would provide funds to the state to deal with lead hazards for households that had either a pregnant person or a young child, or I think also seniors can qualify. And the state operated that grant for many years and then just stopped in 2017. And they still have not restarted. Like getting them to restart accepting federal funds for important programs has been a challenge.
Yeah.
It seems like there ought to be an oversight person for testing of houses, and it should include radon, it should include lead, it should include asbestos, and it should be standard. And if it was that, so that everything was collected in one place, it seems like it would be easier to then move forward. It's kind of like having 4 trash haulers show up in your neighborhood in Delaware because, oh, that's all right. So we have all these trucks driving around the street with 20 houses. I mean, part of it is this Delaware mindset of freedom or whatever it is, but it seems like because it's small, it gets away with this kind of disorganized approach to all these things that ought to be looked at and mitigated and, be part of the whole process.
Well, let me
Think,
connect the dots for you on some in a way that I think is especially toxic about Delaware. The history of lead poisoning, especially pertaining to children, is very deeply embedded in structural white supremacy.
yeah.
And that is very well established in the literature and goes back 100 years. Nearly every, if not every, company that produced lead that contaminated the environment was incorporated in Delaware.
Well,
So
there
the
you go.
state of Delaware has uniquely profited off of lead poisoning. The companies that are involved in some of the most substantial lead poisoning that have occurred are still incredibly influential in the state, like DuPont, which was the sole manufacturer of leaded gasoline in this country for a very long time. So I think the corporate culture here and the defensiveness that we have and the implicit racism of all of this makes it especially hard.
I agree.
Sarah and I, she mentioned this, when we first started on all of this, it was like trying to convince every member of the General Assembly that lead poisoning still existed in this state. And that was really hard because the state was not publishing any data. They had not published complete reports to the CDC in years. They had never produced a map with lead poisoning cases by zip code, which is, kind of like rudimentary epidemiology stuff. So the progress that has been made on lead poisoning in this state has been by brute force.
Mm-hmm. Good lobbying.
Well, and things like, I mean, environmental awareness of air pollution. I mean, the churches and the communities close to the river and all that, all the industry they kept amazing data that was never put together and put out there just because, I don't know. I mean, it was interesting. It was interesting to me to move to Delaware from Ohio. Now, Ohio is kind of big and the libraries were connected so coming to Delaware where everybody was their own little kingdom back in the beginning of the 90s, I was like, oh my gosh, what's going on here? So I just feel like we have to we have to be the Dr. Salks and test the vaccine ourselves and then put it on a sugar cube and everybody came and did it, because they believed it. And when was that? When I was in junior high, right? But I mean, it's such a uphill battle because of how things went through COVID and how we're gonna get back to trusting people. And I know Delaware has had a different thing in that whole process as well because of what you're saying, the structure of the white supremacist pro-capital capital capitalism, I guess. And
Yeah, I mean, one of the ways this manifests itself is
yeah,
it continues to this day. We have had arguments recently with folks about this. They blame the victim. Blame the
right.
victim. Okay, so you just aren't cleaning your house. You have a dirty house, so your child has lead poisoning. And that is the talking point of the Lead Industries Association in like 1920. That is their talking point. Blame Black and Puerto Rican mothers for keeping a dirty house so that we can continue to sell lead paint. So I hear it, it's like a huge red flag. But when it is said by people in government,
Yeah.
it's even worse. We have to get past this victim blaming for the what it takes to keep your house clean for dust or for germs or for just clutter is so different than decontaminating for lead.
Mhm.
And even professional cleaning doesn't last. It's a very temporary solution. So,
Well, and a lot of those people have been the professional cleaners of a lot of other places in that
well,
whole in that
that's a
whole
point.
scheme of
They know
things.
what
It's
they're
really
doing. It's just you can't
crazy.
keep up with it. Lead will spall off the wall through oxidization and then get all over everything. It's not just dust and chips and things. It's
Right.
it's
Right.
ubiquitous.
Yeah, well,
Well,
like windowsills are a big source of lead
Yeah.
dust.
Mhm.
Yes.
I mean, just opening and closing the window, it is a big source. But I just like to follow up on that because I do think there's a stigma of, you know, uh, poor people, minorities, they're living in these rental homes that they're not taking care of, blah, blah, blah. Well, you know what? There's a lot of white middle class, upper middle class people whose kids are exposed they buy these beautiful old homes. They don't know what's in those
Yeah.
homes. I mean, I've heard cases of, people like in Germantown in Philadelphia, they buy these gorgeous old homes. They don't think about the fact that they could have lead paint.
Yeah, and then they do a home renovation, right? They sand
And
the
that's
door
how they find out.
frames, and then everybody gets lead poison. And the
Yeah,
lead
so
poisoning can go down the block.
right,
Yeah.
right.
Yeah. Letty, your
Yeah.
hand is up
Yeah, I
again.
have a question for that.
Uh-huh.
But as a kid, I used to eat chalk, and I was I guess I didn't get enough calcium. So I'm wondering, wasn't there lead in chalk? And since maybe my brain is not as sharp as
Yeah.
no, I really ate a lot of chalk.
You know, there's a continuous association between lead and clay.
Oh,
So I'm not sure if chalk is made from clay, but like all the clay toothpaste, you can buy these powdered clay toothpaste, and it's very popular among backpackers and things because it weighs less, but those are all high in lead.
mm.
So anything with clay, in fact,
Mm.
pottery as
Pottery.
a hobby is high lead, not just because of the glaze. We always think of the lead glaze, but the clay itself.
Mhm. Well, where I lived, they painted, I was in a foreign country. They painted the houses white, and we had chickens, that I let out of the cages, lots of chickens. And they would come to the school and they would peck all the white paint off on the side of the house. I'm wondering, it must have been a lot of calcium there, but but I was wondering, I was eating it too, but in chalk. In chalk.
So did they test the chickens before they
Oh, no,
ate them
they
for
didn't.
lead?
It's when I was a little kid, so hey, I just remember this discussion because I was wondering, my goodness, I've been eating a lot of chalk when I was.
So what's the quote? When we know better, we do better. So we really have to kind of flip this
I know.
conversation to what we now know and what we're going to do about it. Otherwise, we get stuck in this endless, beating our heads against the wall instead of in action.
Mhm.
So
Well, I will just to add on to, and I agree with you, Renee. To add on to what Letty was saying, there are countries where they have banned, selling lead paint, and they will export it to other countries. I mean, this is something that, there's a lot of ways that people continue to make money off lead paint, even when they don't use it in their own country because they know that it is unsafe.
well,
So, yeah.
and even if there's regulation, companies in this country sent things to other countries, pesticides and paint. I'm sure DuPont, unloaded what they had. I mean, all those things happened. They're wrong. And how are we going to move forward is really our question, I think. And what are we going to stand for? Hi, Judy.
Judy?
Judy, you have a question?
Yeah. So this is for Sarah. Sarah, being a nurse and connected with schools, I'm wondering why an earlier part of our conversation was about nurses have the ability or the equipment, at least some of them, to test for lead, but it's not being done. Like, what is that about?
Well, and Amy, jump in. Okay, so I think it's about perhaps how it was rolled out. So, we have the 12-month and the 24-month test. That's something that happens, and the school nurses, their job is to check to make sure that every child starting kindergarten has a lead test. So the really interesting thing about how Delaware works is the people who are in charge of checking to make sure kids have lead tests have traditionally not been the people performing the tests. So we know that all kids need to be tested at 12 and 24 months, but who we hold accountable for those tests, we hold child care centers accountable. They can lose their license if somebody is in a child care center without that test, yet a child care center cannot perform a test. And our school nurses have to check every child when they enter kindergarten. So the thought behind putting those in the schools was to not only, the school nurses are chasing around these students at the beginning of the year, when they're entering school. Sometimes it's because our system in Delaware is still functioning like the 80s and 90s. They don't have a system like they do for immunizations where school nurses can log in and say, hey, so-and-so has their lead test. They have to call public health. They have to say, this is my list of kids that I haven't been able. We tried very hard to work with then Lieutenant Governor Bethany Hall Long to have a system where school nurses could log in. We were told there were HIPAA issues. These are registered nurses working in our schools who very much are qualified and understand HIPAA, who have access to medical records, immunization records, they still would not give them the access to check kids. So the capillary monitors were not distributed in a way, I think, that they weren't, in a way that there was maybe a uniform process. In addition to that, it took, was it like a year, Amy? There had to be an order written from public health, from a physician, so that school nurses could perform those. And that took a really long time to get that order, I feel like. It was like a year or something. So there was a number of reasons why the machines weren't used. Did you have anything else, Amy, you wanted to add to that?
I'm not clear all the reasons why the machines aren't used. Some of the districts are using them more than others. Christina is using theirs. Red Clay declined even getting the machines because they don't believe the technology is valid, even though it is approved by CDC for this use. So there's you know how we are in Delaware? We've got how many school districts? Like 20 or more. And all this decision making is fractured. And then the Department of Public Health just kind of dumps 30 machines into the school district thing. And then they never follow up or provide supports. And so, I mean, there's probably a lot of reasons why.
A lot. Yeah.
But what I want to know is if they don't want them, if the school nurses, and even in some schools don't want them, there are other places that do want machines, and accessing the machine is a huge obstacle, just the upfront cost. So let's move them. Let's move them where they will be used so that we can have. Now, when we did the pilot, which I put the report of the pilot in the chat, when they did the pilot where they tested the school age kids, and you can see in there, school nurses didn't want to play a role. And in the pilot, and they brought in the mobile units that the DHSS has, where they go around communities, and the mobile units were developed during COVID, really to access areas where there were a lot of seniors and things. But we got the lead machines on the mobile units, and they brought the mobile units in to do the testing.
Well, is your feeling, I wonder, Amy and Sarah, if your feeling is with our new governor, who seems to have an educational mandate on himself, like to really improve our educational system. Like, is this a new time to make these kind of pushes to?
It is a good time to make the pushes, and our governor did campaign on wanting to let out of drinking water in schools. But the governor's team is not as responsive as the previous administration's team. So getting the message in has been harder. It's been harder. Which is why things like maybe letting the secretary know we want to fund this from like a couple of people would maybe have an impact rather than just hearing it from Sarah and I.
Thank you.
Yeah.
I will just add on to that, Judy. I do know that school nurses were also, at least I heard this come up at least once, if not more than once. So as Amy said, once that test happens, it goes to the state. I think there's also concern just that, there won't be the wraparound, like who is then responsible for following up with that case management, making sure that and I think we've discussed this throughout, there's a continuous theme here that, if you don't push them, the follow through doesn't always happen. There's a lot of reasons why, but I think there could have been concern from school nurses, like, okay, so we find this, now what? Like, will this family get help? And so I think it's just perhaps another thing that school nurses, who are the only person in the building, doing this, might feel like it's just another thing that's external that they're, being handed. So I think it probably needs to be done in a more uniform way. And that's another thing with public health that we have said all along. If it comes from you, people will do it. When we pass the 2-year testing, it was like pulling teeth to get them to send a letter to all the primary care
They
providers
still
and the
haven't done
pediatricians.
it.
Yeah,
They still
to just
haven't sent
say
a
the rule
letter.
has changed. So we had child care providers telling, who could lose their license if these kids don't have their 12 and 20 more intense, calling pediatricians. The pediatricians are like, oh, we don't need to do that because the state wouldn't send the letter saying the law has changed. So it's like, it's just this continuous, it's like pushing a rock up a hill. And it's not always like that, but it's frequently. It's more 9 times out of 10, it feels like that.
So,
Yeah.
so who's the I mean, is there an enlightened person who you could suggest that we have these mobile units that that are scheduled at certain schools, and you get as much of this testing done with with those units as possible, and it would be cheaper to do it that way. It wouldn't be so much responsibility on the nurses, and they would get a lot of it done. And then you could find the people who got missed because they weren't there or because whatever, and just have that be a separate thing. I mean, it seems like there's lots of people who sit around and make plans, and they don't really think about the actions that are connected to the plans that they make. And so, how do we move things at a different pace? I mean, I feel like one of the hurdles will be parents who don't want anybody to stick a needle in their kid's finger, and that'll be people that get in the way of this. But if it's set up and it's organized and they're doing it on a certain day and they know it's going to happen, if that parent wants their kid to not go to school that day because they don't want to have the lead test done, it's up to them. But we can test them, the schools, and move it forward. So we're not just sitting around talking about it and not having it be able to happen. I don't know. I'm 76. Life's too short to keep putting things off that
Isn't it
need to be
true?
done.
And there was a group in New York in the 60s. I think they were called the Harlem Kings.
Yeah.
And they stole the mobile units from New York and went and tested the kids themselves. And I think about how long I was not born then, right? How long people have been radical on lead and what it has taken. And I'm not directly advocating for stealing state property, but I do think it shows the urgency, right? And we have a really uncanny ability of over bureaucratizing everything in this state, requiring obscene amounts of funds for very small projects, inconsistent funds. One of the big problems Sarah and I had with the state not funding its own lead program was that the state never asked for funds for its lead program. And we're like, we cannot get this in the budget without you. You have to ask for money or you will never get any. And, this is just,
Well, right.
yeah.
And dragging it out takes more
Yeah.
time and more money and more planning and more people than would take to get the job done.
That's right. And in the
I just
meantime,
go,
in the meantime, you've got more and more kids every day that goes by. More and more kids are exposed. More
so
and more
when are we all
kids have
going down there?
lifelong. That's right. Session starts first week of January.
Hey.
Yeah.
Group, a parents group. Natalie had to jump off, but of people who are who are your parental supporters. I mean, Natalie had this experience. I fortunately have not, but it sounds like there are a lot of the rental people who are their kids, and they are the victims, and they would be the spokespeople in Dover.
Well,
Often,
I think this gets complicated, Jill, and we kind of have this a level of uncomfort with asking victims to share their stories and surrender their privacy to get action on policy that is already done all around us and is responsible.
Yeah.
So, I mean, if it comes to that, I just hate to see it come to that. There have been parents who have wanted to testify in Dover, but like we had a family, the News Journal, they impacted in Wilmington, and the News Journal printed their name. And it's going to live forever. Like the kid, the lead stigma, the home
Very real.
address,
Lead stigma is
all
very real.
there. It's going to live forever. And I don't know if the child will, I mean, it's hard enough to overcome having a lead exposure, but then having the eternal
Label.
story of you associated with this stigmatic, deeply embedded in racism. They call them leadheads, right? Because there's the stigma that they're stupid, and all of this is not fair, right? This is all
Lead,
very
we know what
unfair.
it does.
So
It's
a
the most
lot of
researched toxin,
yeah, a lot of the things Sarah and I have tried very hard to do is accomplish policy goals without having victims have to re-victimize themselves with a public disclosure. I mean, we just don't think that that's from a health policy perspective that we find that abusive.
So is it legislators that can make a difference, or is it people in the state government, in the governor's office? Who would be the point people to look for a change in
Well, I
this?
think it has to be everybody. The legislatures have what we experience this year with lead and rental housing is an indication of how everything goes sideways and falls apart because not everybody's on the same page. So one of the fundamental people opposing the lead and rental housing bill was the secretary of DHSS. She testified against it at multiple hearings, in hearings in the House and in hearings in the Senate. And that was just appalling. That was absolutely appalling. Meanwhile, the governor is telling me in the parking lot, oh, yeah, we got to get this done. And I'm like, well, then get your girl online because she is off the rails. But it didn't happen. And then, all you have to do is insert administrative doubt. And then the voices of the landlords get amplified. And before you know it, I mean, March could roll around and we could lose everything. So I think the governor has to be vocally supportive of eradicating lead poisoning, but that isn't enough. He actually has to have his staff working for it, and he has to have the support of the General Assembly. And I think he would have the support of the General Assembly. The General Assembly has repeatedly shown support. I mean, a lot of the legislation Sarah and I have put forward has passed unanimously.
There's bipartisan support for lead poisoning prevention. Absolutely.
Yeah. So I think it could happen, but this whole thing about the the secretary of DHSS is now gone. She's been replaced. And I kind of wonder if that didn't play a role or not. I have no way of knowing, but it's an odd coincidence. But the new secretary has not come on the record yet about her stand on lead poisoning or lead poisoning prevention. So we're going to have to see if she'll play or if she'll be an obstacle. We don't know.
Kyle Evans-Gay, where you said that the lieutenant governor had been helpful, but
that was Bethany Ho-Long previously.
Or not helpful, I can't remember. And I just wonder if I don't know who's, portfolio is whose portfolio. So
well, we did reach out to her as part of the transition team with an entire outline of a governor's plan for a lead-safe Delaware. And that just kind of went into the garbage can. No response, no nothing. And so my level of confidence for some of these players is, and then also the transition team had members on it which were lobbyists against some of our lead stuff in the past. So,
well, that's not good.
It's a complicated political sphere. And here's the problem is, like, Sarah and I have been at this since 2016. We are now the holders of institutional memory on everything. Like, there's so much turnover. There's constant turnover in, all of these people. And it's just like, okay, so you see people pop up and you're like, all right, I see that for what it is, but nobody else in the room understands because everyone is always new. And there's this theory that I love. It comes from fisheries management. It's by a man named Daniel Pauly, and it's called shifting baseline syndrome. And in that theory, every generation of a new fishery manager, they look at the status of the stock and they see it as normal. And then the stock declines, but it's incrementally a little bit less than before. So the baseline of what is considered normal degrades over time, but people don't acknowledge it. And I think that happens in public policy everywhere, not just in like fisheries management.
Yeah.
And I think we've really documented that in lead. There's been like, we're on our fourth or fifth DENREC secretary. I mean, there's like so much change. And then the learning curve for lead is high. The new director of the Childhood Lead Poisoning Prevention Program that just started in the summer has no background in lead. And, that's already been identified as an issue. And then the baseline is degrading over time. And it's enough to like tank tuna. It's harming kids with lead.
So the clarity has to be in what the mission is.
That's right.
So that can get communicated to all the new people who show up.
Yeah.
We really don't want kids to have to face lead poisoning because it's detrimental in this way, and who knows what other ways. We haven't done all the research yet, but we know this much and we need to change this. I mean, you have to go in it with that way.
That's right.
Every new person.
It's preventable.
Right.
It's 100%.
It's tiring, doesn't it?
Entirely preventable.
Yeah.
It's tiring. I mean, we've been fighting for the environment since the 70s.
Right.
And
Right.
and we've been fighting for women's rights since,
Yeah, and we're seeing
Equal
how
Rights
everything, they'll pull a thread and try to unravel it. And all the time, it's like
Right.
playing defense is exhausting, and then you're trying to play offense.
Mhm.
So
Okay, I'm going to go now, but thank
take care,
you so much.
Julius. Nice
Okay,
to see
bye-bye.
you.
See you.
Yes, I just wanted to be respectful of your time. So I don't know how much time you can, you want to spend here.
I mean, I can hang out for a little bit.
Same.
I mean, just let us know how we can help and how we can be supportive, because I've often thought that what people need is the way in for what fits in their lives.
Yeah.
I've often told the people at the Unitarian Church, can't we just have a blind date and then think about how we're going to move forward? Because if we talk about it till we can't breathe anymore, we're not going to get anything done. So, I mean, I think that's why I was much happier working with 10-year-old boys in a 9 to 12-year-old class in a Montessori classroom, because we didn't sit around waiting.
Which congregation is yours on the Unitarian?
First Unitarian on Concord Pike.
Okay, Concord Pike.
But I was a Montessori teacher for my career. And
is that near the Delmarva Utility Towers? Is it near the Montessori school?
First Unitarian Church? No, it's on Concord Pike. And
Okay.
I worked in Hockessin and at Wilmington Montessori as well. But it's been a while, 2018, right? But kids, I mean, kids, it's easier to work with kids because they don't have the timeline memory that has to get drug out every time for things. So it's my favorite story is they would be fighting to see who was going to be first in line, and I'd say, okay, how many people really need to be first in line? And 3 kids would raise their hand. I said, okay, we need 3 lines. Then, because there's solutions that don't take forever if you can move things forward and if people really stop and are thinking. So how are we going to meet these people and do this? I'm working on a couple other things right now, but
Well, Renee, if you share your contact information, we'll add you to our coalition, and that would be great. We'd love to
They're
have
going to
your
send me more
voice.
things I have to read. I need a list of action items that I can
That's right.
pick and
Action
choose from
items.
because
Yeah.
I have that kind of energy.
Yeah.
So
yeah.
I
You
appreciate
have a
your,
lot more energy. I will tell you, one of the difficulties Sarah and I have, I'm going to overshare about us, is we're both really like 99th degree introverts.
oh,
And
I'm
so,
sorry.
yeah, I know it's like,
Well, it's
it's
almost as bad as being an extrovert.
right. So it's just like everything just takes extra psychological power. Like, okay, let's get it going. It's just, and then the recovery, right?
Yeah.
Yeah.
But anyway, you know, I always my theory that I should always listen to is don't say yes on a good day, because if you say yes on a good day, you don't have the energy to really follow
Well,
through
that's
enough.
smart. That's smart. There's this
It's
thing,
hard.
no November, no November. November is the month of saying no. And I'm like, yeah, that's right. It's November now. It's all no's. Those
But
things. And
the governor, before he was governor, used to show up at our invasive plant cleanup behind the
oh,
library, and he was great. And so, the fact that he got in office and it feels a little bit different is I think, oh, wait a minute. I think I need to speak to you about this and this. So anyway, it's you know, and now I'm somewhere between districts because I haven't voted because I moved to a different house in Wilmington, and so I know D is the Newcastle County representative, right? But you know what?
yeah, Dee, what are you even doing here and not
That's
fielding phone calls about the data
that's
center? I mean,
the
Trust me,
is
I'm getting
your
plenty of
email
emails.
blowing up? I saw
Oh,
that
you don't even
there.
know the half of it unless you've been following it
oh
today, that Janet
did
filed all kinds of amendments.
I
did the meeting get canceled? I kept going
No,
to the
no, it's
state
tomorrow.
government trying to figure out what they were doing.
Bring us up to
Well, we
speed
had
on
the
what's
discussion
happening.
last week, and then tomorrow night I honestly don't tell anyone, but I think it's going to be tabled tomorrow night as we work through some of the
The
amendments that were
details.
proposed. Well,
I know. I watched
so
Dustin's thing and I was like, oh my
yeah,
gosh.
yeah.
it got very, very complicated today, unfortunately.
I just called
It's
her office.
crazy how the coalition that's working against it is union driven. I know you'll appreciate that, Amy.
That's
I,
right. That's
I,
right. We
it's
old foes,
crazy.
familiar foes.
Yeah. So we'll see what happens, but
I called Janet's office today because I knew that
good.
it was her thing. And the person who answered, I said, listen, tell me why in fact and who in fact was she trying to placate when she put this amendment there? Because I'm trying to understand it. I'm in Maine now and I haven't been party to all the goings on, and I just listened to Dustin, and it's kind of like, and he goes, well, I don't really know, and I can't really tell you. And I'm thinking, well, then you shouldn't be answering the phone in her office. I didn't
Well,
say that to
isn't
him,
that a great thing?
but I
That's a
said
great
it,
one.
you know, and
What are you doing answering the phone if you don't
If
know?
you don't know the answers,
I'm
I didn't say
saving that
that.
one for the next time I call Chris
let it go
Coons'
to
office.
voicemail.
Because he's trying to be really polite, and then I'm looking like where is she, and is she nowhere near where this data center is going to be, and where's her district? Because I'm like, I
Right,
don't know
right,
it's like, that, I mean, that's the kind of holistic what's happening in the environment thing that a teacher does, right?
right,
Because you're trying to figure out what's going on everywhere and why.
right.
But
Hmm.
anyway,
Me
Good luck
and
with that, Dee.
Sarah, thank you,
yeah.
thank you, thank you. I don't know
Thanks for
about the rest of
having
you guys,
us.
It was
but
great to
I
learn
need
more.
to check out, and Dee needs to go back and figure out how to deal with.
Oh,
Yeah,
I thought you were going to
check
say
your
Dee needs
emails.
to go check her email about data centers.
Yeah, well, yeah,
I think
no,
they're
no,
gonna
no.
cancel the whole meeting. That's what I think.
Well,
Go have
no,
a
it's
great.
our regular meeting, but I think it will be tabled. But anyway, um,
Well, Thank
No,
you
I
for
won't-
fighting.
I
Sarah-
promise you when I post this to YouTube, I'll like cut all this off.
Cut off. And I
Oh, yeah,
listened in on the meeting last week about the whole thing, and I was just appalled at how everybody was so catty. And I was like, Dee's the only voice on there that sounds like you're an adult. Like everyone else was just a child.
Yeah.
It's crazy.
Well,
Really
have a
crazy.
good
Bye,
have a
there, Dee.
Thank
Well,
you
thank
both.
you.
Thank you
I
so
will
much.
certainly I hope other
Thanks.
people would do your action item. That was a good
Good.
pitch there.
All
Thank
right.
you very much.
Take care. Have a good
Thank you.
night.
Good night,
Good luck
everybody.
in the next
Good night.
protest.
Happy green drinks. Goodbye.